Different types of pelvic pain. It could be acute and chronic. The one that is actually more difficult to treat and diagnosis more difficult will be chronic pelvic pain, which is called CPP. And I've written quite a lot of, done a lot of research in this, and some of the results and publications can be viewed under this video. Chronic pelvic pain is regarded as a symptom and not a diagnosis in my view, and it encompasses 3 parameters because you have to check the location of the pain, the severity of the pain, and the duration. It is most important, it is most commonly defined as a pain in terms of location. This pain is located in the lower abdominal part or pelvic cavity or buttocks. And this pain can be continuous or intermittent. It could be cyclical or non-cyclical in nature. And it should impose functional limitation in activities of daily living, leading to poorer quality of life. That is, it has to be severe enough. In terms of duration, the pain is usually a benign pain in nature, i.e. is not malignant, and must have been persistent for at least 6 months. The pelvis is a very complex region, especially female pelvis. It's a very complex region of the body, and its geography and complicated neuroanatomy makes the diagnosis of pain in this region extremely challenging. Delay in treatment frequently converts an acute or noxious stimulus into an entity collectively known as chronic pelvic pain. There's a very heavy economic and social implication for patients living with chronic pelvic pain. Therefore, it is of paramount importance to ensure that accurate diagnosis and effective management of this condition can be implemented very early in the presentation. Well, currently, there are very limited evidence-based treatment options for chronic pelvic pain. So one reason that definitive treatment of chronic pelvic pain remains elusive is the fact that it's a very broad diagnosis of exclusion. It often encompasses many other pathologic states and evolution. Therefore, a multidisciplinary and multimodal treatment approach, including those in Department of Medicine, i.e. physicians, those in surgery, i.e. the surgeons, and those that are involved with therapy should be involved. In gynecological population, the 5 prevalent conditions that are seen in my patients with chronic pelvic pain, they are usually due to either endometriosis, painful bladder syndrome, or interstitial cystitis, that's the old title, irritable bowel syndrome, pelvic floor dysfunction, and a very rare condition called pudendal nerve entrapment. The last one is probably the most unrecognized cause of chronic pelvic pain, and is the pudendal nerve entrapment, and it affects only 4% of patients with chronic pelvic pain. Oh yes, good healthy eating, regular exercise, and early advice from the healthcare professionals are probably the most important, such that the diagnosis can be made early and intervention can be more or less directed to the cause of the pain early. Oh yes, as I've alluded to before, irritable bowel syndrome, interstitial cystitis or painful bladder syndrome, endometriosis, and chronic PID are very serious medical conditions. And once you have a chronic pelvic pain that is affecting your quality of life, especially if you are in the reproductive age group, that you seek intervention or seek advice from the healthcare professionals early. I will share one story of a lady who has been having chronic pelvic pain and has been moved from one healthcare professional to another without any specific intervention. Eventually, it turned out that she had an endometriosis, and by the time the diagnosis was made, almost about 7 years after the initial symptoms, has had quite a very bad pelvic endometriosis, stage 3 to 4, which has compromised the fertility of that patient. And therefore, my advice will be seek medical attention like any medical condition as soon as the symptoms are felt. Acute and chronic pain are terms that are used to describe different durations and characteristics of pain in the pelvic region. But the key differences between them are as follows. In terms of duration, for the acute pain, the pain refers to sudden and severe pain that lasts for a relatively short period, usually less than 3 months. Whereas chronic pelvic pain refers to persistent or recurrent pain that lasts for an extended period of time, typically lasting for more than 3 months. And in my publication, we usually recommend up to about 6 months. And the onset. Acute pain often has a sudden onset and is typically associated with a specific cause or event, such as an injury, infection like appendicitis, or surgery. Chronic pelvic pain, on the other hand, may have a gradual or insidious onset, and it can develop and persist over time without an identifiable cause. What about the intensity? Acute pain is usually often more acute, more intense, and more severe, and it may significantly impact daily activities and quality of life. On the other hand, chronic pelvic pain vary in intensity, ranging from very mild to severe, and may be more persistent than acute pain. In relation to etiology, I mean the cause, acute pain is generally caused by a specific condition or event, such as appendicitis, ovarian cyst rupture, urinary tract infection, or PID, or pelvic inflammatory disease. Whereas chronic pelvic pain can have multiple potential causes, including endometriosis, pelvic adhesions, PID, irritable bowel syndrome, interstitial cystitis, musculoskeletal disorders, and even nerve-related conditions. And in relation to treatment and management, acute pain often requires immediate medical attention and treatment to address the underlying cause or condition, for example, appendicitis, appendectomy. And treatment may involve medications such as antibiotics, surgical interventions, or other appropriate interventions. Chronic pelvic pain, managing this pain involves a multidisciplinary approach involving many specialties and may require a combination of treatments such as medication for pain management, hormone therapies, physical therapy, lifestyle modifications, counseling, and even complementary therapies. The focus is on providing long-term relief and improving the individual's quality of life. It is important to note that distinction between acute and chronic pain is not solely based on duration, but also on the underlying causes, intensity, and impact on daily functioning. If you are experiencing any pelvic pain, it is crucial to consult with a healthcare professional for an accurate diagnosis and appropriate management.